Hey, hello everyone, and welcome to yet another Tooth Talk with your dentist on thedentaire.com. I'm Dr. Rekha, and the Tooth Talk with your dentist is an initiative to increase oral and dental health awareness among people. Do visit our website www.thedentaire.com to get more information about your oral and dental health. Subscribe to our YouTube channel, and you can follow us on Facebook, Twitter, Instagram, Telegram, and on LinkedIn. And in conversation with me today on the Tooth Talk, I have Dr. R M Lalitha. To give you a brief introduction about Dr. R M Lalitha, Dr. Lalitha is an oral and maxillofacial surgeon with special interest in the study and treatment of oral cancer. She is a graduate from the prestigious Government Dental College, passing out with her BDS and MDS degrees from the GDC, Bangalore. She is served as the professor and the head of the Department of Oral and Maxillofacial Surgery from MS Ramaya Hospital and College. With more than over 30 years of experience in both major and minor surgical procedures and in oral cancer, Dr. Lalitha is pioneer in her field. She has several state, national, and international research papers published. Most of the research papers revolve around oral cancer. She has been the guest speaker in several national and international platforms. Dr. Lalitha has to her credit many dental camps and workshops on oral cancer. Dr. Lalitha has served as a guide to several young research scholars and postgraduates in their theses and research publications. She is a member of the IDA, the Association of Oral and Maxillofacial Surgeons of India, and the Karnataka Cancer Society. Dr. Lalitha has been awarded with the Raga's Women Achiever of the Month by the Guild of Women Achievers, the Best Paper Award for her research papers, and the T.C. White Scholarship for the year 2002 from India, from the Royal College of Surgeons, Glasgow, Scotland, for advanced training in maxillofacial surgery. Hello, ma'am, and welcome yet another Two Talk with your dentist conversation. Thank you so much for joining in with me today.
Yes, thank you, Dr. Rekha. I'm glad I'm here with you today.
Yes, ma'am. Ma'am, we have done a lot of conversations and a lot of talks. So I thought today, why not do some very brief question and answer kind of a thing where we can try to incorporate as much information as possible under one topic.
All right.
So something like the most common doubts patients would get. So probably if we talk today about a tooth removal procedures or a tooth extraction procedures, the most common doubts our patients would get about tooth removal.
Yes. Yes.
So ma'am, my first question is: tooth removal painful?
No, it is not painful at all. So it is not painful because of two reasons. One is because of the good armamentarium we are using. The needle is very thin and the prick is going to be very, very painless. And to avoid the prick also, we apply topical anesthesia. So once the local anesthetic is administered, then the anesthesia will last for almost 90 minutes. So during the removal, the patient will not have any pain unless they have some belief system that it is going to be painful.
Yes, yes. So I think talking to the patients beforehand and preparing them for the procedure makes a huge difference.
Yes,
Yes. So tooth removal is actually a painless procedure.
right, right.
Okay, ma'am. The next question: is tooth removal expensive?
No, it is not expensive. I mean, it is quite what we can say is reasonably. So
Yes.
whenever extraction is done by a BDS or an MDS, it is the same. So the charges are very, very
Nominal.
reasonable. So it is
Nominal.
not economically burdening the patient
Patient.
because we charge the overheads.
Hmm.
So we use good sterilization procedures and then we dispose of. So it is not very expensive.
Expensive. So, ma'am, then does tooth removal cause swelling?
No, it does not cause any swelling after extraction because they will have a feeling that their face is numb
Swollen.
and they feel it is swollen. So it should not cause any swelling unless they have some infection.
Hmm.
So if they experience any swelling, it is better to revert back to the dentist
The
and
dentist.
inform. So
So otherwise,
uh,
under normal circumstances, tooth removal does not cause swelling.
well,
Okay, ma'am. Then most of them could think, does someone have to get their wisdom tooth removed always? Is it a norm to remove the wisdom tooth?
I mean, as being an oral surgeon, I would say yes, because whenever a wisdom tooth has erupted in an abnormal position and it is not able to come into the normal occlusion, then it is more harmful to the surrounding structures like the neighboring teeth. So,
Ma'am, can you just exit once and come back? Huh.
yeah.
I see you
So,
now.
we advise whenever we happen to see a patient with a wisdom tooth, after doing a thorough clinical examination and radiological examination, we decide whether it has to be removed. So 90% it has to go.
Be
It
removed.
has to be
Be removed.
surgical.
Removed. Ma'am, a cold pack versus hot pack after a tooth removal. What should be done?
Cold pack is always advised after extraction, after surgical extraction. We advise them to keep some ice packs on the cheeks.
Cheek.
So hot fermentation should not be given at any distance. We
Yes.
don't advise hot fermentation,
Okay.
especially in the facial area.
Facial area. Yes. Yes. Ma'am, will there be bleeding after a tooth removal?
See, whatever bleeding does occur after tooth removal, it is very minimal. So we tell them to keep pressed in that area for minimum 20 to 30 minutes. And we tell them to keep the mouth closed, not to put the tongue there. So that what we call as clot stabilization will occur. So if we follow these instructions, there should not be any bleeding after extraction.
So that means after extraction, there is no excessive bleeding. Only that minimum bleeding that happens till the time the clot forms and remains in the place is all that will be. And after that,
Yeah,
there will not be any bleeding for the patient.
yes.
Yes. Okay.
If
Can a patient? Yes, ma'am.
it occurs, then we have to think of something abnormal. In the course of extraction, there will be not be much bleeding.
Okay. So, can the patient talk after a tooth removal?
So we tell them not to talk too much after extraction. So minimum 30 minutes they have to keep the cotton in position. And once the cotton is removed after 30 minutes, the minimum talking can be done. There's no problem. So, but not because they have to move the tongue and open and close the mouth, isn't it? So we advise them to be at rest.
Yes, yes. Because I think during talking, what happens is because, like you said, because of tongue movements, there's a possibility of the clot that will get dislodged,
Hmm.
and then it will hamper the healing in that area.
No, not necessarily, but the, the area of extraction, they should not meddle with it
Disturb,
in that.
disturb. Yes, yes, yes. So, can somebody brush their teeth after a tooth removal?
They can brush only after 24. We usually tell them after extraction, do not do any gargle for today, do not do any brushing today. Only tomorrow morning, if I have done the extraction today morning, then I will tell them tomorrow morning only you can do the gargling and
Brush,
toothbrushing.
brushing. So there has to
Yeah,
be a 24 hours time gap between a tooth removal and brushing their teeth, or
yes,
even
yes,
or even rinsing their mouth for that matter.
right. So we usually advise them to rinse their mouth with antiseptic the next day.
Next day, the next day. So, can someone eat after a tooth removal?
See, what I always tell is they can eat. So the first thing they should eat, we used to tell, is an ice cream or a cold juice. So the timing is very important. 30 minutes after extract the cotton will be removed. So then they take a uh, cold food. So
Hmm.
they should not use any spicy or hot food.
Hmm.
So the advice is if you are eating rice, rasam, a soft diet is preferred, not
Hmm.
to chew on that side. So
Hmm.
we tell them to mince the rice and rasam and then make it into a porridge kind and swallow.
So,
So diet is advised.
okay. Okay. And, ma'am, will every tooth removal require stitches?
Not necessarily. Every tooth removal does not require stitches. Only when we have meddled with the bone, and sometimes due to the surgical removal of the roots, which is broken because of when the tooth itself is easily decayed and we cannot remove it in one piece, then we might have to trim the bone and then remove the roots separately. Then we give a stitch. So for extractions, we don't do stitching per se.
So if, when stitches are placed, probably the patient has to wait for 1 week's time for the healing of the area to happen and then get the stitches removed.
Yeah, we tell them to come back after 7 days for
Removal.
stitches. Yeah,
Yes. Ma'am, thank you so much for your answers. And I really hope our patients do get some basic information about, information about tooth removal.
yeah. I'm
Uh, th-
glad to be here, Rika. Thank you so much.
Thank you so much, ma'am. Thank you so much. So, viewers, that was Dr. R M Lalitha who did answer our questions on some very important aspects of tooth removal, which you might want to know. If you still have any doubts or queries, please do write to us and we will get back to you on that. So, for more information about your oral and dental health, do visit our website www.thedentaire.com. Do subscribe to our YouTube channel and you can follow us on Facebook, Twitter, Instagram, Telegram, and on LinkedIn. So until next time that I come back with another dentist on another topic on your oral and dental health, keep smiling, stay safe, and be happy. Thank you.